deGhetaldi. I'm the physician executive for Sutter Health in Santa Cruz County. I was young when I came here. I ran into a professor of medicine at USC who said, if you have a social conscience, you will go into primary care. You will treat every patient you see the same, and you believe that healthcare is a right and not a privilege. One of the things you learn in primary care is that community health or population health is probably the best way you improve the health of a community. Midway through my career in Santa Cruz, I shifted from 100% clinical, urgent care, primary care to essentially 100% administrative medicine. Something happened in 1995 in Santa Cruz that most people don't know happened that changed the way we take care of patients here. The Central California Alliance for Health was started, and it became a county-run program to care for and have complete responsibility for caring for the low-income patients in Santa Cruz. It shifted from state to local, and when I saw that happen, it changed the way I started to think about patients that were covered by government programs. As I became more and more interested in that, I realized that just taking care of patients, which I loved, was probably not the best way to improve the health of now 280,000 people that live in Santa Cruz. What we've tried to do is provide universal coverage for everybody in Santa Cruz. One of the most exciting things about Santa Cruz County is everybody's come together to do it. One of the things that we did in the community is we assembled the safety net providers with the dignity providers and with the Sutter providers to come up with solutions to cover the uninsured. We continue to have a very robust, healthy safety net for undocumented folks or for folks that don't have insurance. In the late 90s, a young mother with her one-year-old child came to Santa Cruz from Guatemala. This young mom started a housekeeping business, raised her daughter, and the daughter started to work at a local safety net clinic. And her mom, in her mid-40s, started to drift into congestive heart failure. She had nowhere to go. The mom was undocumented. The mom had no access to health insurance. And her daughter said, "Mom, come to my community clinic. We will see you. You don't need health insurance." And she did. And they identified that she was in heart failure, and they didn't know exactly why. They had nowhere to send her, so they sent her to one of the cardiologists here. She needed the services of Dominican Hospital and the PAMF heart surgeon there. I called Nan Mickowitz at Dominican. This was right before Christmas. And Nan said, of course, send her. We will take care of her. And she had a complex repair to the septum in her heart, and instantly she was healed. An undocumented person, the mother of a dreamer, no access to health care, precluded by federal law from becoming a Medi-Cal beneficiary. And Sutter and Dignity worked together to give her 40 years. Before the Affordable Care Act, Santa Cruz, we had about 55,000 people that were uninsured. After the Affordable Care Act, and a year or so into it, we were down to 20,000. Their lives have been greatly improved. Their health care is better, their diabetes is better controlled, they receive preventative services, they don't rely on the emergency room, they're not exposed to bankruptcy because of health care costs because they have health insurance. And the peace of mind that it's brought families is immeasurable. That's been, over the last 5 years, the most exciting thing that we've seen here. The quality of care in Santa Cruz is at or tied with the best county in California, and California is extraordinary. The dream would be that we can continue to offer health care to everyone that comes to us and needs health care, focusing on preventative health care for everyone that lives in the county. And we can do that in a sustainable way.